good morning, afternoon, evening. It all depends where in the world you are. Today we have an interview with Tomas Pueyo. Tomas Pueyo is based at Stanford University. Tomas, you will tell us a little bit more about yourself, just for a few seconds. And you have written very interesting posts, very scientifically researched, statistically researched post on flattening the curve, on the current situation with COVID-19 coronavirus pandemic and the prospects for the future. And we would like to ask you a series of questions in this short interview. Thank you for being here. My name is Luis Franceschi, Senior Director of Governance and Peace at the Commonwealth Secretariat in London. I'm French by descent, Venezuelan by birth, and Kenyan by choice. Thomas, tell us something little about you.
I'm French-Spanish engineer that lives in Silicon Valley. I've worked here for over 10 years after I came here to study my MBA at Stanford. And I came to fame in the coronavirus epidemic because I initially wrote some articles that got over 60 million views, 60. And one of them, The Hammer and the Dance, has been quoted by different governments around the world as a blueprint for their strategy. I am now writing more articles, more in detail about specific aspects of the management of the coronavirus, such as testing, contact tracing, and things like that. And I am helping, however I can, governments around the world to manage the epidemic.
Fantastic. Thomas, based on your view of the COVID-19 data on some African countries, for example, like Kenya, Nigeria, South Africa, certainly Africa is a complex continent. It's not just one set of values, situations, social realities, but very many varied. But what do you see as Africa's trajectory and risk for the next few weeks?
Yeah, I think the situation in Nigeria, in Africa, is very similar, different from the situation in Western countries, and most of the analysis has been focused on Western countries. So we need to really make a difference between them. And when we look at a continent like Africa and the different countries there, you can see some of the patterns that are also common in some countries in Latin America or South Asia, for example. I think it really depends per country. It seems like there's at least two types of countries in Africa. You can see the South Africa and countries in North Africa that have patterns that are closer to the Western world. And then countries more in the middle of Africa that have a different pattern. And the two different patterns that I see is in South Africa and Northern African countries, you see a higher fatality rate. You also see that applying a hammer works. The hammer is this situation where you have a heavy lockdown of the economy and you ask people to stay at home, and that reduces the cases. So we're seeing that happening in some countries. One of them, I think, is Morocco, where it's helping, it's working. But then you have countries like Kenya, for example, where a few things are happening. One is the number of cases is actually quite low compared to what would have been expected. And it's not clear whether it's why that's the case. One hypothesis is that the disease took longer to get to the country, and then the country was more ready. Another one might be the epidemiologic expertise that the country has compared to Western countries. Another one might be just the fact that there's less testing, although in the case of Kenya, there's a fair amount of testing. Another one might be just that the population is more used to epidemics like this, so they don't register as much, or that, for example, the age of the population is so much younger, and the age of it matters a lot. As we know, people that are older, especially 80 years old and older, are much more affected than people that are younger than 40. And so having a younger population means that you are less affected. You have a high percentage of people who are going to be asymptomatic, and then maybe the virus is spreading, just that it doesn't register. There's another hypothesis, such as temperature and humidity, which we know impact the virus. So there's many reasons why we might see this pattern being different. But these big differences are usually, number one, that the number of cases is actually lower than in Western countries, and then the fatality rate is also lower, but also that applying a hammer has less of impact of completely stopping the virus versus what we see in some of the Western countries.
Okay, something interesting we have observed is that in some African countries there seem to have been abuses. Police force, for example, beating up citizens to oblige them to go into social distancing. So, for example, they beat you up so that you may not die, which sounds like a contradiction. But do you think they are ready to relax their hammers? What advice could we give to these African countries where the case levels have not been as high as expected or as feared? And should they now start relaxing and opening up, or what should the approach to relaxation be?
So first on the beatings, obviously not something that I endorse, but there's something that is important to note, which is it's not that somebody is penalized to save that person. Somebody's penalized to save the community. And in Europe, for example, there's going to be, in Spain, for example, 800,000 fines for leaving home. In East Asian countries, violating these type of laws is a very big deal. If you violate, for example, a quarantine in Taiwan or in Singapore, I think the cost is in the tens of thousands of American dollars. So this is a big deal, and not because people are protecting you, but because they're protecting the community. Now, on what to do, it really depends, right? I think the question is, when going from the hammer to the dance, is, are you ready for the dance? And there's many factors for that. You want to be ready to so that your healthcare system is not collapsed. You want to have enough testing so that if you have an upsurge, you're still covered and you have a good sense of where the cases are. You want to have contact tracing so that you, once you identify a case, you can trace all the contacts. You need the ability to isolate and quarantine people, and these things are really different, because the isolation is when we know somebody's sick, we should get this person out of the street, even potentially out of their home, because if they stay home and they're spreading this to their family, then this is not being stopped. And so what East Asian countries do is isolating these people. They put them in hotels. The hotel is paid for by the government, and there's food and so on and so forth. And they do that until there's no symptoms, and the tests and the tests, the PCR tests turn negative twice. Quarantines need to be able to be enforced. Mask wearing, public education on healthcare, hygiene, social physical distancing. These are all the things that help make the dance work. Now, in many of these countries, and let's just take Kenya as an example, the number of cases per day is quite low. Right? It's in the 10s, in the 20s. That is so low that it makes no sense to keep the impact of the economic lockdown to the entire country. And we're talking about millions of people. This is low enough that it makes no sense to keep the lockdown. So I would say this is always a cost and benefit. It sounds like the cost of doing this is extremely high for the economy. It looks like the benefit right now is not in the tens or thousands of lives or millions of lives. And so it makes sense to open up. Now, you obviously want to open up in an intelligent way, right? So all the stuff, all the parts of the economy that are going to have the highest benefit at the lowest cost are the ones that you want to open up. And you want to open them up in a way that is going to reduce as much as possible the infection rate. So for example, if you have businesses where people are not going to be in very close contact talking to each other a lot, then those are the first ones that you want to open. Schools actually are probably something safe to open, first because kids are not at risk, but also because the social networks in schools are usually closed. It is the same people meeting over and over again. You don't have cross-pollination between different social networks. And then another thing you can do is, if these 20 or 30 cases or whatnot that we're seeing every day in the country are localized, then you open up the country, and it's only the areas where these cases are localized that you keep some quarantines, and you focus all your attention on testing and contact tracing. So I think bottom line is, I think the cost benefit is different for a country like Kenya than a country like Spain, and costs are potentially higher. The benefits are potentially lower of a lockdown. So we should definitely start opening the country at an accelerated pace.
So, for example, you would advocate for an opening up or advancing in clusters. For example, let's say we open up schools, but we do not open up for school inter-school competitions.
For example,
you open up universities, but you do not open up for activities between universities. That type of
that's right. And then obviously, whenever you can, you enable physical distancing and masking, right? So masks is an obvious one where everybody, or not everybody, but a lot of people can easily get a cloth mask that is that you can wear over and over again, that you wash. And this should be a no-brainer. If everybody, it's mandatory to wear it, the transmission rate can be reduced substantially. And so you can combine that with public education to make sure that it's properly built and it's properly worn. And then something else along the lines of what you're saying is, outdoors is very, very different from indoors. And so, for example, agriculture, like there's no reason to close anything in agriculture, right? Because it's so indoors, outdoors, and the density of people usually is low. But for example, a market, you might want to be much more concerned about a market, because there's a lot of people very concentrated in one place talking to each other, and that is potentially a focus of spread. So you want to be very, very cautious about those.
Yeah, fantastic. Something that has happened recently in Kenya, for example, is that you have certain slum areas where a disproportionate number of cases are appearing, which is very tricky because you can't have the physical social distancing. Have you seen in any country successful cases of social distancing in other ways than just physical? I don't know, this is a tricky issue, but
I hear you. I think like from like if you abstract away, right, what you have is an area where there's very high density, people live together, and it's just so hard to keep them apart. The attack rate is very high inside of families, even outside of slums. So I can imagine inside of slums. I think that at the end of the day, what you're trying is to avoid the infection from one person to another, right? And then so that spreads into the rest of the country. And so you can do it at the individual level, but you can also do it at the group level. So the masking and health and hygiene, and public education become extremely important in Islam. Because if you really can reduce the transmission from one person to another, and you can do that aggressively, you might be able to keep people physically close to each other, but still not spreading the virus substantially. And the second option is also doing lockdowns, but lockdowns that are limited in geographic scope. So if you do a lockdown within or in the area of Islam, then suddenly you don't impact the economy of the rest of the country. But you also need to support these people, because otherwise, if you quarantine them but you don't support them, they're not going to have a livelihood and they're going to leave. And so one of the potential ways to reduce the spread in the slum is giving food, for example,
Yeah.
people, or supporting them so that they can cope with the quarantine.
Yeah. And have you seen in any country, and this is a lesson we can learn in Africa from other experiences, situations where countries are beginning to relax the rules, the hammers, they are starting the dance, and there is a surge in the pandemic? Or could there be a surge in the pandemic, and how would you handle that?
The reopenings are just happening right now,
Mm-hmm.
and there's very few countries that have been long enough to have one. Interestingly, if you take the United States and you look at each one of these states as a country, you can see that happening in states in the United States. And an example is Texas. Texas had a reduction in cases, and now they have an increase. And the US has never been, different states are different, but many states in the United States have not been very good at locking down their population. And when they have, they've locked it down for a short period of time, and and the population has not been very responsible in abiding by it. And so now they're opening up the states, and the growth rate is going up. So we are seeing this. I wouldn't take those countries as an example of management. I think a better example of management is maybe Singapore and South Korea. So we can look at what they've done. In the case of South Korea, they had an outbreak with 10,000 cases. It was concentrated in the city of Daegu. And so what they did was very focused lockdowns in Daegu. So people actually mostly stayed at home during that epidemic, even if the city did not mandate citywide lockdowns. They did close some schools. They did close some businesses. But mostly they did a lot of testing and contact tracing. So Kenya is a good example where I believe there's a fair amount of testing and a fair amount of experience contact tracing, and they can focus their attention in these areas. They can focus. Can country like Kenya could focus their resources in isolating and quarantining these people. So especially the isolations that we were talking about, if you extract these people and you put them in a hotel or in an area that where they can't infect people, and you support them during that time, then they're much more likely to abide by it, and reduce the transmission rate to the rest of the community. I think Singapore has seen something actually quite similar to something that we discuss around the slums in Kenya, where you really have two populations in Singapore. You have the population of the immigrant workers that work in dormitories, that live in dormitories and very, very close to each other with high density. And then you have the rest of the city. And the rest of the city has barely been touched by the pandemic. But these dormitories have been extremely, extremely impacted. Nearly all of the thousands of cases that Singapore is seeing are from there. And so the things that Singapore did not do were masking. Masking was not mandatory. Social gatherings were not limited to a certain number of people. And then they had travel restriction. They did not have travel restrictions from these countries, right? So now they have all three. And so I think the learning for a country like Kenya might be first masking. Masking is super important. If you have high density areas where people meet a lot, masking will definitely help. And then the other one is just social gatherings. Like each time two people spend a bunch of time together, talking, singing, touching each other for a long period of time in an indoors environment, the virus is going to be more likely to spread. So the more you can do to limit this type of interaction, the better you'll be.
Some lessons countries outside Africa could learn from Africa. We hear that, for example, in Senegal, they have come up with very cheap testing kits, etc. What would you say is a good lesson the world could learn from Africa? It's too early to tell, perhaps you will tell me, but by the observation and the numbers and what you are seeing, what is your take on that?
Yeah, so it is hard, it is early, and also to give a detailed answer to that, you need to be very close to the details of each one of the countries, which I'm not. So I only know a high level for many of them. And a couple of things that I can say is one, like if I just take Morocco, it's a country that has been able to put aggressive measures to reduce the spread, and it has worked. You can see actually the peak number of daily cases was around 200, and now I think they're around 100. And you look at the mobility numbers, and it looks like the lockdown did make people stay home. So I think Morocco is a very promising country. I think interestingly, Morocco is really in between. I think in terms of the economy and probably society, is in between Europe and Africa. And so it's similar that to see that in a country like that, measures similar to Europe's have had similar results. I don't know again many of the countries, but everything I read about Kenya is actually very reasonable. The number of cases is super low. It is growing, but it's not growing dramatically. The testing is reasonably high. The contact tracing is actually quite good, and so I think that it is easy for, or it's common for people in developed countries to just not pay attention. But if you just look at the numbers, a country like Kenya is doing pretty good.
Yeah, fantastic. Well, you see, I have an African grandmother. I hope there's something genetic also in the makeup of.
Yeah, and that honestly is one of the biggest problems, right? I think we don't know enough to know what's the cause of these different behavior, because the number of cases and growth per day is lower in developing countries as a rule of thumb than in developed ones. And so when you have this type of divide, there's a question of really what's the cause. One of them is very likely to be the age. And the age pyramid is going to be very important here, where countries with a lot of older people, like in Europe, will have a higher fatality rate than countries that are developing. Also, heat and temperature seem to have a massive impact. And so it might be that a lot of the difference between a country like Kenya and a country like Spain is just due to luck. But if you look at also how the epidemic has been handled, it does look like a country like Kenya has been doing a better job than a country like Spain or France.
Yeah, fantastic. Well, and now to finish, generally speaking, of the work you have been doing, the studies, the following of the COVID-19 pandemic you have been doing, what is the latest exciting observation or discovery you have come across? Exciting or worrying?
Yeah. So a few things. One is just a prepub that I started reading yesterday around different strains of the virus, and it looks like one has been predominant in Western countries, and we're not sure exactly why. It looks like it's a different strain from the one in China, and it might be luck that it just happens to be a strain that is different. It might not be. It might be some other reason that makes it more transmittable, and also the fact that the fatality rate in Europe is so much higher gives the fear that this might be a more deadly strain. Now, it is just a pre-publication, and it is not clear that this might be the case, but it is a worrying fact. Another worrying fact for me is the constant news around the chronic impact that this disease has in many people, like lungs that are scarred potentially for life, kidneys that fail, blood that gets impacted in weird ways. And so one of my fears is that people only look at the fatality rate as a way to measure how bad this is, when in fact chronic conditions could also be really bad. It's just harder to count, so people don't. On the measures side, I think over the last couple of weeks, there's been enough data to say that there's a lot of measures that are expensive but don't need to be applied, such as closing businesses and schools, especially schools. Schools are have a very positive impact in society, both in terms of education and in terms of childcare and allowing parents to work. And they also have a relatively low epidemiological cost because classes are always the same network, and so they're less likely to spread the virus across different social networks. Same thing for businesses. There are a couple of expensive measures that might be necessary over the medium to long term. One of them is travel restrictions. If a country like Kenya is doing a great job at controlling the virus, but then it imports cases from the UK because the flights are still open with the UK or get open at some point, well, all the good work that the country has done will be wasted. So there's a world where travel bans will be necessary for a very long time, especially between countries that are properly controlling the virus and the ones that are not. The last one is limits to social gatherings. Nearly all of the cases that we see tend to be focused on big social gatherings that happened in South Korea, it happened in Singapore, it happened in Spain, it happened in Germany. And so limiting the size of social gatherings, especially the social gatherings that mix different social networks together, I think is key and will be needed over the medium term until we have a vaccine.
Yeah. Well, fantastic. Thanks a lot. This has been great learning, great lessons, great ideas. It's also worrying, I mean, to know how the world will be in the next at least few months until a vaccine is found. Well, certainly we are in the, as people say, the new normal, but nobody knows how new it will be.
Yeah.
So it has been fantastic, and thanks a lot. All the best. Keep up those interesting and exciting posts. We are learning a lot, and I'm sure everyone in Kenya, across the world, in the whole Commonwealth will be very excited to keep on reading you and trying to see what's next.
Thank you for having me. It's a pleasure, and I haven't been paying enough attention in the past to developing countries, but the calculation is so different from the one in developed countries that is very much important to do that. So I'll be doing that more and more over the next few weeks.
Fantastic. Well, after all, most of the population of the world is in developing countries.
Absolutely.
Excellent.